back to Customized Relief. Curtis Beal here with Dr. Christopher Roberts. Pleasure to be joining you all again for another installment of things that we're very excited about here at this practice. And one thing we wanted to talk about today that's really near and dear to our hearts here at this practice has to do with stem cells. As everybody knows, stem cells are all the rage right now. And we actually have a very cool new technology that we're excited to bring to patients, and we're already utilizing with quite a bit of success. So I'm going to kind of turn it over to Dr. Roberts because he's kind of the forefront master with our VSEL therapy is what it is. So can you kind of just tell us about our specific laser, how it's different, and maybe start with what is a VSEL compared to other stem cells?
Yeah, no, good question. Again, we are very blessed in what we have at the practice here. Stem cell therapy, as Curtis said, has been used and is being used all over the country now for a multitude of different things, from joint repair to, I mean, obviously in cancer therapy, it's used for other reasons. But what's interesting about this particular form is that these are V cells, which are very small embryonic-like stem cells that we literally have circulating in our own bloodstream. So if you go to other sites, you'll typically either get your own stem cells out of fat or out of bone marrow. The problem with those is that you typically don't get enough. You have to then treat them with something to proliferate them to make enough to then inject into areas that, again, you're trying to get healing. Well, the beauty is with the V cells, again, I have these circulating in my own bloodstream. I actually extract them with just setting an IV in, drawing about 120 mLs of blood out. You spin them down like you would do for what's called PRP or platelet-rich plasma. But what is in that plasma, which is the kind of the yellow part of the blood at the top that we draw off, are all these V cells. The interesting thing about V cells is that they're completely dormant, they're inactive, and they literally have been circulating in our system since the day we were born. But because they're inactive, there's no damage internally that's going on to them. We tell our patients that mitochondria are really the source of about 93% of all the free radicals that we make, and so it can cause damage within the cell. Well, these cells don't get that damage, and so they're literally very much like the cells that we had when we were born. The other benefit to these is that, again, they're small, and so they can go to areas that you otherwise can't penetrate, including they will cross the blood-brain barrier. No other stem cell that's out there can do that at this point. So that can be beneficial. But what we've discovered is that you can take a photobiomodulating laser, and it's a laser at the infrared spectrum, and you can actually activate or turn on all those little mitochondria. When you do that, you now have just turned on an army of stem cells that you can use for treatment.
So let's get into the treatment side of things. I know that's what everyone is very interested in. What types of things are we using this V cell and the laser for specifically, and then what other things can it actually treat?
Great question. And again, I want to be a little careful because, again, this is not an FDA approved procedure, and so I have to be careful in saying what it can get. It's not that it can cure anything. We're going to call it supportive therapy, but we find that it's very supportive in joint-related issues. We've had patients who've had back issues, even things like osteoporosis. What's really neat is that this actually has been used in a few cases for heart failure. It can have potentially have some impact, again, supportively for chronic kidney disease. So again, rising creatinine levels, etc. And so far, we've actually found that it may have some benefit for some of the neurodegenerative conditions that patients may struggle with. And so, again, there are no claims for cure. I have to be very careful how I say this. This is not FDA approved. But if there's anything that can impact areas of health that we currently don't have good treatment options for, it appears this may have some benefit in those areas.
When can patients expect to start seeing results?
It's different for different people, and again, we tell everybody that as they come in. Usually for kind of the musculoskeletal back issues, etc., patients can actually experience the day of the treatment some improvements. Now, again, no guarantees with that, Most of them within the first 3 months after the treatment will be able to see how much did I benefit. Now, in some of the patients with neurodegenerative or neurocognitive issues, it may take more than one treatment. That's the other issue, to get them to a point where they're, again, better. It's just going to be patient dependent.
Yeah, very good. Any other closing thoughts on the laser that you can think of?
I think the thing that I like about it the most is that it's your own stem cells. We don't do anything to manipulate the numbers that we have. All we're doing is turning on stem cells that have been circulating in our system since the day we were born. And stem cells notoriously, when they get into an area where there's damage, know what to do. Again, God designed our bodies to self-heal. We're just activating stem cells to then get into, and again, I didn't really mention this, but the laser, once we turn on these stem cells, we've harmonized the stem cells to the frequency of the laser. We can then use that laser just externally to guide those stem cells to concentrate, not all of them, but a significant number to concentrate in the area where the damage is, or the area that we're trying to treat. And so it's really neat. The whole treatment process is basically IV. We will occasionally inject joints. If I have a patient with a knee issue or a shoulder issue, we'll occasionally inject, again, V cells that have been charged with the laser into the space. But the whole thing takes about an hour to do.
Yeah, it's really exciting. We're excited to be able to offer it here at Customized Relief. And again, the website, mdbiophysics.com, if you're just looking for information. I think they even have studies on there. And then obviously with any other questions, feel free to reach out to our office, and we're happy to do short consults to discuss. And yeah, we look forward to seeing you all soon.